Good morning, students. Today we are going to discuss the clavicle bone. This is a modified long bone which is lying horizontally in the body. It has shaft and two ends. Now, for side determination, what are the points you should keep in mind is that the medial two-third portion of the anterior side or anterior surface is convex forward. You can see it is convex, and lateral one-third is concave. So S-shaped curve is there, but medial two-third is convex anteriorly. That you should place this convex surface anteriorly, and lateral one-third should be concave anteriorly. Second point is that the ends, that is this end which is quadrilateral, that is going to articulate with the sternum and it should face medially, and this flattened end, that is from above downward, it should place laterally. So this bone is of which side? It is of right side. And the third point for the side determination is, if next point we see, this is the subclavian groove which should face inferiorly. So superior and inferior surface are demarcated by this groove. The groove is lying inferiorly. The ends, which is sternal end and which is the lateral end, so this quadrilateral end should face medially, and this flattened part from above downward, it should face laterally. And regarding the anterior surface, medial two-third portion convex and lateral one-third is concave. So these are the points which helps in determining the side of this bone. So this bone is of which side? It is of right side. Now coming to the description of the different ends. Now if we discuss the lateral part of this bone, so I show you, this is the concave margin. It is convex posteriorly. Definitely if it is concave anteriorly, it is convex posteriorly. Now this end is flattened above downward. It has superior surface, it has inferior surface. So two surfaces are there for this bone. It has anterior border which is concave. It has posterior border which is convex. Now if we see the inferior surface, it has a tubercle. This is known as the conide tubercle. And from this conide tubercle, a ridge is present. This is known as the trapezoid ridge. So this is the conide tubercle, this is the trapezoid ridge. And this end is going to articulate with the acromion. You can see a oval facet is present, which is going to articulate with the facet which is present on the acromion process of the scapula to form the acromioclavicular joint. Now coming to the medial two-third portion, it is convex anteriorly and concave posteriorly. It has four surfaces. It has superior surface, it has anterior surface, it has posterior surface, and it has inferior surface. On the inferior surface you can see a facet, rough area. So this oval rough area is visible on the inferior surface. Now this is regarding the description. The medial end of this bone is going to articulate with the manubrium sterni to form the sternoclavicular joint. It is going to articulate with the first rib, so to form the costoclavicular joint. So this end is sternal end, which is covered by the fibrous capsule. Here on this sternal end or medial end of this bone, interclavicular ligament is attached. That is important. And on the inferior surface, this rough area is giving attachment to the costoclavicular ligament. So the costoclavicular ligament is attached on this rough oval impression. So interclavicular ligament is attached at this portion at the medial end of this clavicle, and it is covered by this quadrilateral portion is covered by the fibrous capsule for the sternoclavicular joint. Now coming to this portion, in this the important ligament is attached coracoclavicular ligament. Coracoclavicular ligament has two parts, that is conide part and trapezoid part. Conide part is attached to this tubercle, that is conide tubercle, and trapezoid part is attached to this trapezoid ridge. So coracoclavicular ligament has two parts, conide and trapezoid part. So this was regarding the different ligament. And what are the other ligament which are related to this? That is articular disc of the sternoclavicular ligament, that is related with it. Then anterior and posterior sternoclavicular ligament, they are attached at the medial end of this. So these are the these are the names of those ligament or important ligament which are going to attach on the clavicle. So in addition to all these important ligament, what are the different muscles which are getting origin and what are the muscles which are inserted on the this clavicle bone. Now the origin is one important muscle is pectoralis major. The pectoralis major is getting origin from the anterior convex surface, that is on the medial 2/3 portion. So pectoralis major is getting origin, and anterior part of the lateral 1/3 is giving origin to the deltoid. The superior surface of the medial part is going to give the origin to the sternocleidomastoid muscle. So this is the sternocleidomastoid muscle which is getting origin from the superior surface. Then sternohyoid muscle which is attached on the posterior surface. So these are the important four muscles which are getting origin from the clavicle. And what are the muscles which are inserted on this? So out of this, one is trapezius, which is attached to the posterior border of the lateral 1/3 portion of the clavicle. And next important muscle which is inserted on the clavicle is subclavius muscle. So a groove is present. You can see a groove is present on the inferior surface. This is known, this groove is for the insertion of subclavius muscle, and the margin of this groove is giving attachment to the clavipectoral fascia. So I have to repeat, the groove is receiving the insertion of subclavius, and to the margins is the attachment of clavipectoral fascia is there. Now this is regarding the clavicle. This is very simple bone. So four muscles are getting origin, two muscles are inserted, and certain ligaments are attached to this bone. Now next point is what are the important features, special features for this bone. So first I told you that this is the modified bone, which is long bone which is lying horizontally. Then this is the first long bone which ossifies in the body. And next important point is it is the only long bone which has two primary centers. Third is regarding its ossification, that it is the only long bone which is getting origin from the membrane. Then next important feature is it does not have any medullary cavity. Clear? So these are the important feature, and most important is that it is subcutaneous. You can feel the bone. So this is subcutaneous throughout. So these are the important points of this clavicle. If we see the sex differences, that is how it is different in males and females. So it is thick and longer in case of males in comparison to females. In males it is thick and longer, and muscular impressions are very much pronounced in the males, and it is more curved in case of males. It is less curved in case of females, but more curved, thicker and longer in case of males, and muscular impressions are very prominent. And which is the growing end of this bone? Medial end is the growing end of this bone. That is important. And this bone is the only long bone which is getting origin in the membrane. So this is all about clavicle. Thank you.